Alison Strudwick. I'm a musculoskeletal physiotherapist. I've owned this private practice for coming up to 15 years here in East Maitland. We're doing a mixture of being open and telehealth, so where people come in for assessment of a condition and prefer to come into the clinic, we can provide that, and then we may at that point say, look, we can follow this up through telehealth, or if it's their preference or there's a need for them to come back. And I'm thinking in terms of plasters, plaster removals, there's all sorts of acute injury that may need bracing and the like that does need to come into the surgery. So we're doing both. We've worked to sort of comply to what the hygiene requirements are and the social distancing, and we've basically now accessed masks. That was a problem for a while, and so we feel we have all the components to be able to provide both services. It does involve embracing telehealth and finding new ways to get information to people to help them sort of understand what their condition is, what they can do to help recover that. So it's bringing in a lot of the aspects of physio that are developing anyway, which is that we are more about education and self-management and fear reduction, I guess, in and around injury, and looking at positive ways that people can help themselves recover. So it really does dovetail into telehealth quite nicely, but the public is certainly not used to that approach. I guess some of the delay has been based around, well, how will it be funded? So in order to promote it to GPs who are also learning that it's available, we've needed to be able to tell them, well, how can your patient access it? So that's all relatively recent information, that health funds are now opening some funding to physios providing telehealth, and they will provide rebates, and Medicare has now come through with a no-gap approach to telehealth. So it's hopefully enough for us to provide good service, and and I guess we're all trying to survive this space of just being able to keep clinics open and keep people being able to access essential health services.
Telehealth in allied health is a bit of a shifting space at this time due to COVID-19. There are many systems available out there for telehealth. First and foremost, I would say consult with your IT provider to find out what works well within your network environment. We at the PHN have access to the Health Direct video call system. We have the ability to roll that out to any allied health or general practice across our region. It's free, it's secure, and it's funded by the federal government. Obviously for telehealth, the key driver has been COVID-19. In an ideal world, funding will be ongoing for allied health and general practice. Also, allied health and general practice will see the benefits of using telehealth, and it will become business as usual into the future.